Listening to that, and with us now, Jamie Jenkins, former head of health analysis at the Office for National Statistics. Hi, Jamie. Welcome to the programme again.
Hi, Gareth. You good?
Look, I guess we're crystal ball time to a certain extent, are we? If we are 2 to 3 weeks behind England, as Mark Drakeford said today, what might Wales look like then in 2 to 3 weeks' time?
Well, I think the first thing probably to kind of point out, Gareth, is when we say behind England, it's probably just the northwest of England, because there's many parts of kind of England where you go down to the southwest over towards London, which have got relatively low rates, and that's the spread of the Delta variant hasn't really hit them as well. So what we've seen is that it kind of started off around the Bolton area, around Blackburn, and it has been kind of spreading as things have been going on. But I've been tracking the data in the northwest as well within England, and what we're seeing really at the moment, as we've opened up the country a little bit in England and in Wales, we've started seeing cases rising. It's not, is it kind of inevitable that would have happened? And as we enable more restrictions to be eased again in the future, that will happen. So what the good news is, though, is all of the rises, when you're looking at it by age group, in England and in Wales, is predominantly among younger people. And some of these younger people are the ones who haven't had some of the first doses of the vaccine in England. And we know Wales are ahead of England with regards to that. So I'd be surprised if Wales gets as kind of high as what it's gone in the northwest of England. But probably the best news when you're looking at the data overall is the most vulnerable people, who are the people who've had 2 doses in Wales now. If you actually track the younger population and the rise in cases there, we're not seeing the rate of rise in the older people like we saw in previous waves. So even though these cases are going up, this isn't wave 1, this isn't wave 2 again. The wave 3 that people are talking about, this rise in cases, is generally among younger people, where we know the vaccine rollout is going to be hitting them and the cases don't hit them as much.
How much would you expect Wales to benefit from the speed of its vaccine rollout? So it's ahead of England on first and second doses. I think it's actually 5th in the world at the moment in terms of the second dose rollout. And the fact that perhaps our rise in the Delta variant is behind parts of England by a number of weeks too. Does that count quite heavily in our favour?
Well, yeah, even the news today from Public Health England, that 1 dose of the vaccine kind of offers you that protection. Because if you look, if you think back to those, those dark days in January, we were seeing, large numbers of deaths over each day, for example. And I've been tracking the data from deaths as well. They've been below average. That's total deaths in Wales now since March. And we've had 64 deaths from COVID reported by ONS and Public Health Wales since the start of April. Now, that's the whole period. That's over a 2.5-month period. And we had 1 day in January, we had several days there where there was more than that amount of deaths over the last 2.5 months in 1 day in Wales. So this is clearly not where we were before. The vaccines are clearly working. And that's great news for us with regards to things. I think as we move forward and more restrictions will ease, we inevitably will see cases going up. But I think given that we're so far ahead of the game with regards to vaccinations, and we're seeing some other parts of the world opening up, Gareth, who've got lower vaccination rates, I think maybe we've been a little bit too cautious. But obviously the First Minister would argue he's got a mandate to do this following the recent election.
And look, if these vaccine stats are right, so that 1 jab, Pfizer or AstraZeneca, reducing your chance of going to hospital by 75%, that's the study you're talking about today. How far off are we from coronavirus being endemic? So it's just a disease like flu, like many other diseases that we live with. And very tragically, some people do die from it. Very tragically, some people do suffer serious illnesses. But it is well within the bounds of something that we just learn to cope with and learn to live with.
Yeah, well, you could say we're there now, Gareth, because if you think of the vaccinations from coronavirus, now, the effectiveness that we're talking about, 70, 80, 90%, these are far greater numbers than we ever get with flu vaccines. Just a couple of years ago, the flu vaccine was only 29% effective, and you'd get new variants of the flu all of the time. So, and also with the flu vaccine, we don't vaccinate the whole population, all the adults, etc. We generally only vaccinate the vulnerable, and then some people can get them as well if they want to on top of that. So we may already be at that stage where we've got to learn to live with the virus, and it's become endemic. New variants will happen all the time. The vaccine companies obviously will be monitoring all of those. And I've got no doubt, Gareth, I'll probably be speaking to you at some point again in the future, talking about a different variant and different numbers of cases. But hopefully we're 1 step ahead of the game with the vaccines defeating the virus.
Are we in a good place then, come the 15th of July, for alert level 1 to happen? So we're looking there predominantly at much more social mixing. So you can go inside someone's house, for example, who's not part of your bubble.
Well, I personally think, looking at the data that I look every day, we were in a good place to do that several weeks ago. Now, The First Minister's chosen to go through this cautious approach. He wants to wait to see some more data, and obviously that's the approach he wants to take. I think if the vaccine rollout continues, we kind of jab in about 20,000 people a day for second jabs, which obviously offers even more that protection. I think if the data is quite positive at the moment, in about 4 weeks' time, you'd be very disappointed if it's kind of hasn't improved again, because ultimately all of the vulnerable are being vaccinated now. The younger age groups where the vaccines rollout is going to hit now, where the spread is more, and we know that the vaccine does reduce the spread as well. Once we hit all those as well, I think all the optimism's there to hopefully get some more of the back end of the summer back to some more normality.
Fingers crossed. Jamie, thanks very much indeed. Jamie Jenkins.